feel like.
Lucky.
So let me go ahead and we can get started.
Great.
Okay. All right, well, here we go. Good evening, everyone, and welcome to our second installment for this month's webinar series. Tonight, we have the pleasure of having Rachel Kaplan present tonight's topic. We have a very interesting and engaging discussion tonight concerning a very popular topic we've all been dealing with ourselves. Tonight, we'll be discussing the impacts of the pandemic on mental health and how to manage this incredibly stressful period in our lives. At this point, I'd like to introduce Rachel. Rachel is a licensed clinical social worker at Mount Sinai Hospital, working on the left ventricular assist device and heart transplant team. Rachel has been working at Mount Sinai for over 5 years and has worked in the cardiac intensive care units, regular cardiac floors, and leading a support group in the outpatient cardiac rehab program. She is also a therapist in private practice in Manhattan, working primarily with adults facing chronic illness, anxiety, and depression. Rachel is a certified in cognitive behavioral therapy, as well as palliative and end-of-life care, and is experienced in mindfulness, chronic illness, and the mind-body connection. Before we begin, I'd like to remind everyone that this is a discussion webinar and we invite questions at any time. Please type them into the text box and we'll answer your question throughout the discussion. Please be aware that there is a survey at the end of this webinar in which we invite you to complete. Any questions that did not get answered, please leave your email and we will try to get back to you as soon as possible. So without further ado, Rachel, the room is all yours.
Okay, thanks so much, Frank. Hi, everyone. Thank you for coming. As Frank mentioned, we wanted to have a webinar to talk about mental health because it is something that all of us, I think, are struggling with right now, given the stress of the pandemic, how long it's been, and everything that we've been dealing with, on top of regular stressors in life and anything else that you may have been struggling with before the pandemic. So I'll tell you a little bit about the goals of the things that I want to bring up today, but as Frank mentioned, as questions come up, please just send them in. But today I'm going to talk a little bit about anxiety, which I think all of us are experiencing to some extent during the past 10 months, and give a little bit of education on what's happening in your brain and your body when you're feeling anxious. Teach a couple of techniques to use when you're feeling anxious, some relaxation techniques, including a breathing technique and a simple mindfulness exercise, as well as some ways to deal with anxious thoughts when they come up. And a lot of that is rooted in cognitive behavioral therapy, since that is an area that I'm really interested in and trained in. And then I'm also going to talk a little bit about mood and depression and the ways that the pandemic may have been impacting that for you, and ways to practice some self-care and cope with all this stress. So before I go into talking about anxiety and depression, I first just want to talk about how normal it is to be having a difficult time right now. So however you have felt, however you're coping is okay. This has been so hard on everyone, and everyone copes differently, not only as individuals, but also day to day or even hour to hour. Sometimes we ourselves cope differently. So you may wake up and feel okay and feel hopeful and feel like you're coping okay with everything that's going on. And then later in the day may feel really anxious or overwhelmed or down. And that's also really normal to fluctuate in the way that you're coping. There's been just so much to adjust to. We've all made a lot of sacrifices. We've been incredibly limited and restricted in what we can do. And so much of our normal routine, the things we enjoy, the things that give us pleasure, seeing friends and family, all of that has really been taken from us. So it's been a lot of losses that we've had to deal with, and a lot of fear around loss as well. We've had the loss of normalcy and our routines. People have lost their jobs, people have lost loved ones, activities. And so while you may not have experienced some of the losses yourself, the fear of these losses is also something that's really impacting our mental health during this time. In addition to that, a lot of us have had changes in our roles. So you may now be a caregiver, you may not have childcare anymore, you may be spending more time with a significant other or family member or roommate that you're not usually spending that much time with, which can be very stressful being home so much. Or on the flip side of that, you may be really isolated and alone a lot, which you're not used to. A lot of us are living with people that we don't usually live with, and that brings up a lot of complex family dynamics and challenges in relationships. A lot of us are working at home now, which was a huge adjustment. It's harder to be active. We haven't been socializing as much. It's difficult to find things to do. So I just wanted to start with that because I want to take a moment to just recognize and also give ourselves credit for everything we've been dealing with and just how hard this is. So it's just, again, if you're having a tough time coping or dealing with any of the symptoms of anxiety or depression that I'm going to talk about, it's appropriate and it's normal. And we're going to just talk about how to deal with it in a different way. So on top of all of that, there's been just so much uncertainty, and uncertainty is really unsettling and really anxiety provoking. It can really impact our mood. We may be asking questions like, when will this end? What will ending even look like? What will our new normal look like? How will we keep coping with this if it's more months to go? What will change in our lives? What will I lose? Will I get sick? Will my loved one get sick? Will I keep my job? There's so much uncertainty to tolerate. So on top of everything that's changed and everything we've had to compromise on and give up, it's been really scary. And the chronicity of all of this and how long it's been is incredibly draining and wearing. So what's happening in our brains and in our bodies with all the anxiety, all of the uncertainty, all of the fear is of course going to impact all of us in different ways in terms of our mental health. But what I want to say that I think is really, really important, if you take nothing else away from tonight, is that having strong emotions is not a sign that something's wrong with you or that you aren't coping. It is a normal human reaction to stress, to extreme stress. Okay, so I'm going to say that again. I think that's the biggest takeaway. Having strong emotions is not a bad thing. It's a normal human reaction to what we're going through. And I also think that word coping is a really important one to think about. People sometimes think coping means you're doing fine, you're not fazed by what's going on, you're not having any issues. That's really not what coping means. Coping means getting through something and dealing with it. And coping can be really hard. And I hear this a lot from the people I'm working with, as well as personally, my family, my friends. They say, oh, I'm not coping well because I'm stressed or I'm anxious or I'm feeling down or I'm feeling hopeless. That doesn't mean that you're not coping. Coping just means getting through something. So with all of that in mind, we need to focus on what we can control because there's so much right now that we can't control. And so we need to learn to cope with and tolerate this uncertainty and also focus on how to take care of ourselves during all of this. So the first piece that I like to talk about as we get past all that uncertainty and everything that you know and that you've been living through, but that I want to just normalize for you is really challenging and just validate that if you're having a hard time, that's normal, is how we respond to our emotions when they do come up. So a lot of us, when we're feeling sad or anxious or frustrated, we often react to ourselves in a way that's sort of critical or judging ourselves for having a hard time or feeling frustrated with ourselves, where we try to suppress or fight or block these emotions. And what unfortunately, I'm sure a lot of you realize in trying to do that with any stressful time, not just now, is that really doesn't make them go away. So just because you don't want to think about the fact that you're really overwhelmed or anxious or feeling down, and maybe you distract yourself from it by doing something, or you kind of put it away for later and get on with your day and function through your job or whatever it may be, those feelings don't go away. And they often then manifest in other ways or come out in other ways. So it's just like this analogy I like to give. It's like pushing dust under a rug. Then you don't see it for a little while and it's out of your view, but eventually it sort of makes lumps under the rug or it comes out on the other side, and it comes out in ways that you wish it hadn't. So let's say you're really anxious or you're feeling really down and you don't deal with it at the time and you just sort of push it away. It's going to maybe come out with you being less patient with a loved one or feeling more irritable or having trouble focusing at work or having less energy. So pushing away and fighting these emotions and not recognizing them and acknowledging them and dealing with them really doesn't work. And when we react in a way that we're judging ourselves or feeling frustrated with ourselves, or a lot of people I hear from start to feel anxious about feeling anxious or feel angry at themselves that they feel angry about what's going on in the world. What happens is it's just adding this other layer to it that makes it even harder to cope, or sometimes makes that emotional experience even more heightened. So I don't think it's something we always take time to think about, is how much we respond to ourselves impacts how we cope and how we feel so much. That does play a really significant role in our emotional experience. So paying attention to this self-talk and this internal dialogue is important, because even if you don't realize it, from the moment we wake up in the morning to the moment we go to sleep, we are responding to ourselves and speaking to ourselves all day. And I think we're all often our harshest critics, and we don't really pay attention to or even realize sometimes how negative that self-talk is. So one of the things I'll recommend you do is really start to notice that when you're feeling something emotionally, or you're having a hard time, or you're having a day where you're just feeling really overwhelmed or anxious about the future and all this uncertainty, notice how you respond to yourself in that moment. We need to give ourselves permission to feel whatever we're feeling without judging it, without trying to control it, and simply just acknowledging it and responding to ourselves with self-compassion and patience and empathy. And I think a really good way to think about this is we really tend not to treat ourselves the same way that we treat other people. So silly as that may sound or childish, really taking a moment to think if someone that you loved, one of your friends or family members came up to you and told you they were having a really hard time with this, feeling really anxious or really depressed, having trouble concentrating at work, doesn't feel motivated to do anything, isn't really connecting with friends anymore, how would you respond to them? You probably wouldn't say, oh, you shouldn't feel that way, just keep going, or oh, that's ridiculous that you're feeling overwhelmed, everyone's going through this. Some of the ways that we do talk to ourselves, you would probably be compassionate and accepting of them and supportive and acknowledge what they're feeling and just allow that. And that's really what we have to do for ourselves. And I think we don't always even notice that we're taking that away from ourselves or adding that extra layer that's making it so much more challenging to cope. So to summarize that, it's really leaning into the feeling when you're having it. You're feeling anxious, you're feeling sad, you're feeling frustrated, you're feeling angry, which are all really normal responses to everything that we're dealing with right now. Just acknowledging it and being there for yourself in the way that you would for someone else without trying to control it or distract yourself from it or push it away. Another tip to deal with this that I think is really useful that I myself, I don't think even do enough either, is thinking of some of the good things that have come out of this, some of the silver linings, as we'll call it. So we're all focusing so much on the losses and the things we're missing out on this year. A lot of us had to reschedule big life events. People have missed weddings and college graduations and haven't been able to have their family reunions. And we've all missed out on a lot. And we feel frustrated and we feel sick of it. And it's hard to know when that's going to end. But I don't think we take enough time to really think about some of the good things that wouldn't have happened without this time. So some examples of this is maybe you've learned some coping mechanisms you didn't know that you had before this time. Maybe certain relationships have been strengthened in your life because of this that you wouldn't really have prioritized, or you're noticing who really is there for you and what kind of relationships you want to have with people, which ones you want to sustain. Maybe you've learned something useful about yourself that's going to be helpful in the future with something else you deal with. Some people I know have developed new hobbies and done new activities, or maybe you just learned how to be alone with yourself a little bit better. These things sound small, but I don't think we're taking a lot of time to acknowledge that. There are good things that come out of everything in life. And so I challenge you also to think about that as you step out of here. What are some of the things that wouldn't have happened that were positive if we weren't stuck in quarantine, not participating in our normal lives for these 10 months and for, maybe who knows how long more. Okay, so I'm going to talk a little bit now about anxiety. I think anxiety is probably one of the most prevalent things everyone is dealing with right now. And even not during the pandemic, anxiety is one of the most common mental health issues in the US. It affects about 40 million adults in the US a year, which is about 18% of the population. And that's before a global pandemic that has caused us to all feel really, really anxious. So I'm going to give a little education about anxiety because I think it's helpful to just understand what's actually happening in your brain and your body when you're anxious and some of the symptoms you may be having when you're anxious. And then helps you to employ some of these strategies that we're going to talk about in response to that. So the first thing that I think is important to think about with anxiety when you're feeling really overwhelmed, maybe your chest feels tight, maybe you're feeling really just jittery and this overall feeling of uneasiness. Maybe you have some thoughts that are coming up for you that you can't control. Reminding yourself that that feeling of anxiety is temporary. And this is really true also with panic attacks, which I'm not going to get into as much tonight, but telling yourself in that moment that as much as it's uncomfortable to feel anxious and it's unpleasant and it feels really scary and overwhelming in the moment, anxiety is temporary. And right now, many of you may say, that feels far from temporary. I'm walking around all the time with this baseline feeling of anxiety, and I just always feel it, or little things just kind of set me off in a way they didn't used to. There are still moments where you're not feeling as overwhelmed or quite as anxious or quite as triggered. And so the feeling of anxiety when it's really overwhelming is a temporary feeling. It does go away because our bodies and our brains aren't designed to release all of the chemicals and go into this response that I'm going to explain a little bit more for anxiety that heightened for very long. Panic attacks actually can only last for a certain amount of time, I think 10 minutes usually maximum, because your body can't produce that much adrenaline and that kind of response and that cortisol for longer than that. So telling yourself in that moment, I know I feel overwhelmed right now, leaning into that, acknowledging it, but that it's a temporary feeling. And there are different pathways to anxiety that I'm going to talk a little bit about. So there's what we call bottom-up anxiety. That's when you're feeling it more in your body, feeling some of those physical symptoms of anxiety. And then there's top-down anxiety, when it's coming more from your mind and more of these thoughts that you're having. So with bottom-up anxiety, everyone experiences this differently, but think about a time you were feeling really physically anxious. So maybe your muscles feel tight, maybe your breathing's a little shallow, maybe your heart's racing, maybe you feel a little tightness in your chest or in your muscles, maybe your stomach feels upset. Everyone gets these physical sensations of anxiety. And what's happening there is this part of your brain called the amygdala is sensing that there's a threat and sending a signal down to your body to get ready to go into this fight, flight, or freeze mode. And it's activating this part of your nervous system called the sympathetic nervous system and telling you to prepare for danger. So in the times of lions and tigers and bears with our ancestors, when you saw an animal and you had to react quickly to get ready to save yourself from that danger, your part of your brain, amygdala, sensed a threat, sensed a danger, sent the signal down to your body to get you ready to fight it or to get out of there. And that's the same thing that's happening now with anxiety. The problem in modern day is that we don't need that as much, and that our brain doesn't really know the difference between real danger and perceived danger. So a lot of times that response still gets triggered from a thought that we're having, or from a memory, or from going somewhere where we had a really negative experience and just being in that place where we were really anxious before something bad happened. We perceive that as a dangerous place, and that emotion is attached to that memory for us. That can be enough to trigger it. So even having a thought like this pandemic's never going to end, I'm not going to be able to deal with this, that can even be enough to send that signal down to your body. So that's what's happening when you're feeling that bottom-up anxiety. I'm going to share my screen for a moment just to show a slide, because I think it's helpful to just sort of see this. That option for me that I had before is not there anymore. Frank, I don't see that option anymore. Sorry, everybody.
Let me see if I can let you share a screen.
Maybe some anxiety you feel in your body when you're giving a presentation and you have a technical difficulty. I think a lot of us can identify with that. Doesn't quite replace being in person.
Yeah. I think we might just have to maybe skip that slide. I'm sorry, I don't see the option on my end to help you.
Oh, you know what? It just popped up. Here we go. Can you see that?
All right.
Okay. Yeah. All right. Thanks for bearing with me there. This is your nervous system in a very, very basic image, but I think it's helpful to see it. So when I'm talking about the signal that's getting sent down from your brain into your body, getting you ready for this fight or flight, we're talking about the sympathetic nervous system. That's what's getting activated here. So if someone looked at you closely, your pupils might be dilated. Sometimes our mouths feel dry when we're anxious because our salivation's gone down. Our breathing feels more rapid or more shallow. Our respiratory rate's gone up. Our heart rate's gone up. I think a lot of us feel that when we're anxious. Glucose is being released into all our limbs, getting ready to fight or flee. And that's, taking that away sometimes from your organs, which is maybe your digestion's impacted by this. This adrenaline's pumping through your body. Your body is literally getting ready to deal with the danger that's coming. And again, that's triggered sometimes just by a thought that you're having. So with some of the strategies I'm going to teach us, what we're trying to do is activate this other side, this parasympathetic nervous system, to sort of balance out what's happening here. We call this the rest and digest mode. So sort of having the opposite effect, bringing the saliva back to your mouth, bringing down your heart rate, bringing down your breathing rate. Glucose is going to all the right places, bringing down that adrenaline, letting your digestion system go back into rest or digest mode. This is what we're trying to activate here when we're using some of these strategies that I'm going to go over. Okay. So what's happening during the pandemic is we are really hypervigilant right now. We are always assessing for threat. So the moment you walk out your door with your mask, trying to keep your distance from people, or in the grocery store, going to work, going for a walk. We're always sort of uncertain and fearful and always on alert in a way that we didn't used to have to be. And so our nervous system really right now is in overdrive, always assessing for threat, always getting ready. Do I need to protect myself from danger? And so just think for a moment about how exhausting and how draining that is. A lot of you might be feeling more tired, have less energy, or having trouble participating in things that you used to want to. And this is a big part of that. This anxiety response is more aroused than normal, more activated, and more easily triggered because we're always in this constant state of assessing for threat. So how do we work with this? What do we do when you're starting to feel these symptoms in your body? So the problem with the amygdala is that, I like to say it this way, it doesn't actually speak English. So let's say you're starting to feel all these symptoms in your body. You may have tried before to say to myself, I'm okay, nothing's wrong right now. It doesn't usually work once this is activated, once your heart's racing, once your mouth feels dry. Trying to tell yourself some of these things when it's this type of anxiety doesn't really work. So what we need to do is send a signal to our brain that we're safe in this moment. And we can do this by grounding ourselves with certain mindfulness exercises, coming back to the present moment and being really aware of our surroundings. And I'm going to teach us a mindfulness exercise that's really simple and easy to use. But I would say one of the biggest techniques, and we're going to go through this too, is deep breathing. And I'm going to just lead us through a quick diaphragmatic breathing exercise. What you want to do with these strategies is you want to use one of these techniques when you notice these warning signs. So it's different for all of us. For instance, I know if I'm feeling anxious, I start to feel like my neck's a little bit tight. I notice my muscles are tensing. That's a warning sign for me that I'm starting to feel anxious. That's when you want to use this deep breathing or the mindfulness before you get to this place of feeling really overwhelmed, really panicked, really anxious. Or for instance, maybe before you do give a presentation and you notice your heart's racing a little bit, and it's not coming from really a thought you're having, but you feel this physical anxiety. And so you take a couple of these deep breaths, you're sending that signal to the amygdala in your brain that you're safe, that there isn't a danger. So I'm going to lead us through this breathing, if everyone will try it with me. Diaphragmatic breathing is different than normal breathing because we're trying to send the air down to our belly. So what you'll notice is usually when we breathe, and especially when we're anxious, we're breathing in a more shallow way where it's going just into our chest. So I'm actually going to ask you to put one hand on your chest and one hand on your stomach, and just notice how you're naturally breathing right now. Likely your hand on top is rising and falling, and that's really common, especially again when we're feeling anxious. So what we're trying to do with diaphragmatic breathing is send the air into our bottom hand, into our diaphragm. So almost imagine there's a balloon there in your belly and you're trying to fill the balloon with air and then empty it out every time you take a breath. And this might feel a little unnatural and uncomfortable at first. This is something that you have to practice to feel really comfortable doing it. And I really recommend practicing it because then in moments of distress, it's going to feel more accessible to you to use as a tool. You don't always need to do it with your hands here, of course, if you're out at the grocery store and feeling overwhelmed. But right now, just for the first practice, it's useful to do. So I'm going to ask you to just take notice for a moment of how your body feels. Maybe roll your shoulders back a little bit, roll your neck around. We hold a lot of tension in our back and our neck when we're stressed or after sitting all day hunched over at the computer at work. Just notice if you're holding tension anywhere. Sometimes our jaw and our face muscles are tight, your lower back. Just do a quick body scan, because then I want you to take a look back at that after we take the breaths. So I'm going to lead us through 3 breaths. I'm going to lead us through 3 breaths. You're going to inhale through your nose for a count of 4. Hold for a moment, and then exhale through your mouth for a count of 6. Again, trying to push the air, even if it feels a little weird, down into the hand that's on your belly. Okay, so let's do it together. I'm going to inhale through your nose for 4, 3, 2, 1, and hold for a moment, and exhale for 6, 5, 4, 3, 2, 1. Inhale for 4, 3, 2, 1, and exhale for 6, 5, 4, 3, 2, 1. Let's do one more. Inhale through your nose into your belly for 4, 3, 2, 1. And exhale for 6, 5, 4, 3, 2, 1. Now I want you to take a moment to again do a quick scan of your body. You may even feel a little more relaxed just from a couple of breaths from this practice. It's profound, the impact it has. And I know it sometimes sounds a little hokey schmokey. A therapist is saying, take deep breaths when you're anxious. There are actually studies where they do MRIs and they can see the amygdala activation decreasing with deep breathing. So there is studies and research to back this up as a really effective tool when you're feeling anxious. It doesn't change the circumstances of what's going on that's stressing you out. It doesn't change that what you're anxious about is really real, but it can just bring down a little bit of what's being activated in your body when you're feeling really anxious. The other technique I'm going to teach is a mindfulness technique. So there's a lot out there about mindfulness right now, and I'm not going to try to sell you on meditation. I'm actually not someone who is very into meditation myself. And I think people have sometimes a misconception about mindfulness, thinking you have to totally clear your head and not have any thoughts. And that's actually really not what it's about. I'm not capable of totally clearing my head and having no thoughts. I've tried. I don't think it's possible for me. And it's great when people can, but that's not what we're trying to do here. What we're trying to do is ground ourselves and refocus on the present when we're feeling overwhelmed and start to feel this in our body. So again, sending that message to our brain that we're safe and bringing down some of that activation that's happening. So this is a really simple tool that I really love. It's called 5, 4, 3, 2, 1. And I wanted to choose these two to teach you because I think, of course, when you're home and you're starting to feel anxious, you can try any of these strategies, but I want ones that are really discreet, that when you're out in the world and you're feeling overwhelmed, you can do these and no one's going to even notice you're doing them. Once you get comfortable with that breath, you don't need your hands there. You're going to be able to use that if you're in line and you're near people and you start to feel anxious. You can use this mindfulness technique if you're at work and you start to feel overwhelmed. So what we're doing here is we're bringing our attention to our 5 senses and just trying to notice details of our surroundings to bring down some of that anxiety that's coming up for us. So I'll bring up the slide as I describe this in case anyone wants to take notes on it. Works this time. Okay. This was the diaphragmatic breathing. The numbers, just to remind you, is 4 counts in, hold for a moment, and release for 6 counts. And if you Google it, there's a lot of videos. If you would prefer someone to walk you through it while you're practicing it the first couple of times, I think that can be really helpful. Okay, our mindfulness exercise. So I'm going to lead us through it here, but do it in your own surroundings where you are now. You're first going to focus on 5 things that you can see and notice 1 or 2 details of them. So for instance, I can see my water bottle. It's blue and it's filled with water. I can see my table. It's wooden and it's brown. I can see a blanket. It's gray and it's soft. I can see a rug. It's green and it also looks soft. And I can see a television. It's black and it's off. And the 5th one, I can see a plant. It's green and it looks healthy. Now, 4 things that you can feel, physically feel. So I can feel the chair underneath me and it's comfortable and it's supportive. I can feel my sweater and it's soft and it's warm. I can feel the table and it's hard and it's smooth. And I can feel my fuzzy socks, the benefits of working at home. They're fuzzy and they're comfortable. Now, 3 things that you can hear. I can hear some horns honking, reminding me I'm in the city. I can hear the dishwasher running and it sounds like it's full of water. And I can hear some people in the hallway. 2 things you can smell. This one, they get a little trickier by the end. I can smell my oil diffuser. That's putting some nice scent into my room, and I can smell my hair. Sometimes you just have to get creative. And the last one is something you can taste. Sometimes you have to take a sip of something to help you with this one. Tasting my water, and it's cold and it's refreshing. So again, this seems really simple, but this is bringing down that activation, really focusing on small details in your current surroundings and the setting you're in, which you can use this anywhere, bringing down some of what's making you feel anxious in that moment. So the other pathway of anxiety, top-down anxiety, this may be one that a lot of people can really identify with too. This is when it's coming more from your mind. So we call this the cognitive piece that we look at in cognitive behavioral therapy. Maybe you're having racing thoughts. A lot of these what if thoughts are coming up for you. What if I get sick? What if I was exposed? What if I never go back to my office? What if I don't have a social life when this is over? a lot of thoughts about these worst case scenarios. I think a lot of us jump to that. We start to worry about the worst possible case that's going to happen. And I think what's really common is when we get in bed at night and there's no more distractions and no more stimuli, all of our fears and worries often come flooding in and are just impossible to ignore at that point. That's why anxiety really impacts sleep a lot of times. It makes it hard to fall asleep because maybe you were distracted during the day working or caring for your child or your loved one, and you didn't have time to really focus on the things that were making you feel anxious, the thoughts that were coming up for you. A lot of times that comes up when we finally have a quiet moment alone. What happens is these thoughts tend to spiral and build on themselves. I'm sure a lot of you can think of examples of this. These what ifs start with maybe something small. What if I was exposed to COVID today? I was kind of near somebody, and then build, and suddenly you're worrying about a family member getting it and dying, or you're worrying about losing your job because you needed time off for being sick. And it just sort of builds on each other and spirals. And it happens to all of us. Sometimes it's less specific and explicit thoughts and just this overall feeling of uneasiness or worrying that we just can't turn off. And this is when the anxiety is coming more from our minds. So what I want to preface this with is that you cannot control the thoughts that you have. We cannot, with any amount of therapy or cognitive behavioral techniques, you can't control the thoughts that come into your head. What you can control is how you respond to them, how you reframe them and reevaluate them, and then how you challenge them when they come up for you. And that's what I'm going to talk about a little bit now to give you some techniques for that. So the first piece is just recognizing and acknowledging the fact that you're having an anxious thought. A lot of us don't even take the time to do that. It's something we're so used to. We are incessant worriers, or, oh, I have anxious thoughts come up all the time for me. We don't take a moment to try to realize that this is just a thought that we're having. Those thoughts feel really powerful when they're coming up, but it is just a thought, and we are not our thoughts, and our thoughts don't mean that something's going to happen. So what we're trying to do here is really take the power away from the thought before it causes all this anxiety for us. So the first piece is just recognizing that and acknowledging that when they're coming up. Oh, I'm having an anxious thought. I'm jumping to this worst case scenario. I'm thinking about what if. And this in itself can be a really powerful tool to sort of stop it in its tracks when it's coming up for you. And as you start to pay more attention to the thoughts that cause you stress and you start to notice the patterns of them, you will be able to catch them a little bit more and respond to them a little bit differently. You may never have tried to even respond to them in that moment. Maybe you have a loved one that you talk to when you have some of these thoughts, and they're able to sort of calm you down or talk you through it and do a little reality testing with you, and maybe that helps. And so we want to learn how to do that for ourselves, how to respond to ourselves when these anxious thoughts come up to help to challenge them. So there are some questions that you can ask yourself once you're at the place where you start to recognize what they are and sort of catch them. I'm having an anxious thought. Notice that you're worrying about something. I'm going to bring up a slide for this too. So some questions to challenge our anxious thoughts. Is my thought based in fear, or is it based in fact? A lot of our thoughts are based in fear. And I know some of these are going to be really hard right now, especially in the pandemic, when we don't know some of the dangers or if we've been exposed or some of the things that are going to happen. But in this moment, you're trying to just focus on the thought that's coming up for you that's causing the anxiety. Do I have evidence to support this thought right now? How likely is this to happen? I know that's a hard one to answer right now too, but a lot of times this fear or this what if that built or this worst case scenario, we don't know how likely it is to happen. But usually we're getting really imaginative and creative with our worries, and we've gone so much farther than what's likely going to happen to us. So am I overestimating how bad this is going to be? And on the flip side of that, I think this is a really important one. Am I underestimating my ability to cope? So even if the worst happens, even if some of my fears are true and they do happen, am I underestimating my ability to cope with it? What is the worst case scenario, and can I handle it? And I know this is a tricky one with some of the pandemic concerns and some of the anxiety that's coming up for us now. What would I tell a friend? I know, going back to sort of what we talked about in the beginning, if your friend came to you with this thought, what would you tell them? I think a lot of times we give really good advice or can be really like logical, critical thinkers with other people, but with ourselves, and when we're feeling more emotional, it's harder to think that clearly and that critically. Have I had these anxious thoughts in the past? What's happened? You probably have a lot of the same worries and some of the same anxious thoughts coming up for you during this period. And what has happened? Maybe some of them have come true and you've been able to cope with it and get through it, but a lot of them haven't actually come to fruition, the things that you were worrying about. The last one I think is really important too, is this thought serving me? So look, at the end of the day, we can't tell you that any of these things you're worrying about aren't going to happen ever in life, but especially right now during the pandemic. but worrying about it and thinking about it is not going to change the outcome. And that thought is not going to serve you. And that's a really important one to ask yourself. Is worrying about this going to change what happens, or am I just having an even more difficult experience because of it? And so sometimes with these questions, what I recommend is even having them written down in front of you as you're practicing responding to your thoughts in this way and going through each one. That may feel really tedious or really silly, but what that practice is going to do, just like practicing the diaphragmatic breathing, is in time, you're going to more naturally be able to respond to yourself like this as these thoughts come up. Okay. The other thing I mentioned is thinking patterns. So we all have patterns of thinking. We sometimes call them cognitive distortions or unhelpful thinking patterns. So some of the really common ones are catastrophizing. We jump to the worst case scenario, kind of blowing things out of proportion. The absolute worst is going to happen. And so again, with this, we're learning names for things so that when they come up and we recognize them, you can say, wait a minute, I'm catastrophizing right now. This is where my anxiety is coming from right now. I'm jumping to this worst case scenario, imagining the worst is going to happen. With that, also jumping to conclusions. A lot of us jump to conclusions when we're anxious. Black or white thinking, sort of this is the way it's going to be, or this is the way it's going to be, not being able to sort of tolerate that uncertainty of both. Maybe this is going to be really hard or stressful, or what I'm worrying about is going to happen, but I probably also am going to be able to deal with it and cope with it better than I thought. And I have support systems in place that are going to help me. Overgeneralizing is another really common one. So I had a really hard time dealing with this today. That means I'm never going to be able to deal with this. Or this person I know got COVID and is really sick. That means if any of us get it, we're going to get really sick. So overgeneralizing is one that I think is super common too. And as you start to notice which ones are coming up for you more, being able to name it again in that moment, stopping it in its tracks and taking some of the power away from it. Negative noticing. We all do this in life a lot. The things that are hard or we're traumatizing or we're difficult are going to always stick out in our memory more. We don't always notice the things that we have gotten through or the things that we've done well or the stressful times that we've coped with. Those don't stick out as much in our minds. So we have to actively try to notice those things more. Give ourselves credit for what we're doing. You got through a day today on a Tuesday in the middle of a global pandemic, did whatever you had to do to get here tonight. And I know that may not sound like a lot, but it's a lot. This is so, so stressful. And you need to be able to notice the positives, notice your successes, even if they feel really small, especially in comparison to maybe the negatives or what's been hard for you, and actively try to notice the positive if you realize that negative noticing is one of these thinking patterns that you're having more often. That was a lot of information. I'm going to move on a little bit to mood and depression, but wondered if there were any questions about any of that before I moved on. I just threw a lot of like a whole course of cognitive behavioral therapy material at you in 30 minutes.
So I don't see any questions that have come in yet, and I do want to encourage, the listeners that if you are thinking about something, this is a very engaging and thought-provoking discussion. I encourage you to answer ask a question, and we'll try to answer it to the best of our ability. We do have one actually that just came in, and the question is, can we get the slides?
Yeah, I can email them to you, Frank, if there's a way to distribute them, or if people want to leave their emails with us, whatever's easiest, sure.
So let me remind everybody that the webinar is actually being recorded. We will be putting the webinar in our Kravis app library. So, and we'll try and send out the recording through the emails and invites that we sent for everyone for tonight. Okay, so.
And I do have a slide at the end with some resources as well. So I'll make sure that that's in there so that everyone has that. Some websites that are helpful and some places you can call if you feel like you're needed.
Can I just add a little something?
Sure.
So at the fourth question in the survey is comments. So anyone who would like a copy of the slide, then they could put their email in there, because the emails are actually hidden when we go to the end to see who registered for the class or the seminar. So if you would like a copy, in the comments, you can put your email and let us know.
Okay, great.
Okay.
Okay.
All right.
Well, I will talk now a little bit about mood and depression. I think this is something a lot of us are struggling with right now too. So just like anxiety, you can have symptoms of depression or mood issues without it meaning that you are having, something that would be a mental illness or mental health issue. It is really, really normal right now if you have days where you're feeling sad, or you have less interest in things that you used to find pleasurable or that you wanted to do. If you have less energy or less motivation to do certain things, or your sleep's impacted by everything we just talked about from all the anxiety. Maybe you have changes in the way that you're eating because you're home all the time. Maybe your weight has changed for that reason. We're not as active. We're not eating as much. Maybe you're having trouble feeling as motivated or concentrating on work. Those are symptoms that can mean that you're having depression, but also can really be normal, appropriate responses to what we're dealing with right now. So having these symptoms doesn't, again, mean anything's wrong with you or that you aren't coping okay with what's going on. All of us have experienced some or most of these at some point in our lives, and likely more so during this time. So a lot of these, again, are normal human reactions to the stress that we're facing. We are very isolated, very restricted. A lot of the things that we once enjoyed or give us purpose are not accessible to us right now. We feel less free or have less control over what our days look like. We're stuck at home, aren't seeing friends or family as much. We may be having more arguments with the person that we're with because none of us ever spent this much time with the person that we're quarantining with, probably. We may feel bored. We may feel sort of hopeless at this point about when the pandemic's going to end because of that chronicity, that piece, the fact that it's been 10 months and there's still a lot of uncertainty. You may be feeling sort of hopeless about that or about other areas of our lives. And I think all of us feel really helpless too, that there's nothing that we can do right now to control what's going on bigger picture. But again, we're trying to focus here on what we can control. And I know for a lot of us, it's hard to believe that this will ever end or that we'll ever get back to some sense of normalcy. So of course, all those things are going to cause changes in our mood. How could they not? A lot of us are feeling more irritable, more tired. I think for me, kind of the screens all the time, I'm feeling a little zoomed out, that Zoom fatigue, which I think is really real for a lot of us. That may make you want to socialize less. In the beginning, a lot of us were Zooming with friends and family, and it felt fun to have that plan on a Saturday night. I don't know about you, but I often don't feel like doing that anymore. I've been sitting at a screen all day at home. I don't want to still be sitting here. Like right now, you're sitting in my office. I don't want to sit here and socialize after and look at a screen the rest of the day. So I feel like I am socializing less. I'm not as interested in it. That's normal. A lot of us are having trouble sleeping, not just because of the anxiety, but we're less active. We're spending less energy during the day. We're home a lot. And a lot of us are in our bedrooms a lot more than we used to be. Some people are working from their bedrooms, or that's where they're hanging out to get some distance from whoever's in the other room. So there's less separation of what that environment means, where you used to come home and when you went to bed, it was your place of sleep. A lot of us are hanging out there watching TV now, or that's where we're spending time. Yeah.
Yes, and so I just wanted to quickly point out, we did have a question come in. I think this is pretty relevant for the topic you're discussing right now. What is the strategy that could be used when irritability or anger surfaces? For example, I did get ill and now have long-term impact from COVID and often get angry when others won't wear a mask.
Mm.
Of course, I can avoid some situations, but others can't be avoided. How can that anger be avoided?
That's a very good question. And I think something a lot of us can relate to when we're doing everything we can to keep ourselves safe and to also participate in keeping the community safe. It does feel really frustrating when other people aren't, especially if you got sick. And I'm sorry that you went through that. First of all, just recognizing that that's a normal reaction. It's normal that you feel angry because of that. And some of the techniques in the beginning about thinking about how you respond to yourself when that feeling comes up for you. When you feel angry, do you get frustrated with yourself for feeling that way? Do you try to suppress it and control it? Or do you give yourself some self-compassion and empathy? Of course, I feel angry after everything I went through that this person is not taking care of me or helping to prevent myself or my family from getting sick. So that's the first piece, is how do you take care of yourself and how do you respond to yourself when that's coming up for you? And then I think also focusing on some of these techniques of what you can control, because unfortunately we can't control what people do. I wish every single person was wearing a mask and being as responsible as it sounds like you are, but we can't control that. And it is super frustrating. And I join you in that frustration and that anger, but we need to focus on what we can control. And so I'm going to go over some ways to do some self-care. So when you maybe are feeling angry, how can then you take care of yourself in that moment? First, acknowledging and being empathetic and compassionate with yourself. It's okay that I feel angry. Of course I do. And then what can I do to take care of myself now in this emotional state? Instead of focusing on how angry I am at this person or all the things I can't control, which again is so understandable that you're feeling that way. But what can I do to take care of myself now? How can I refocus this energy I have in taking care of myself while I feel this emotion? And the other piece I'm going to talk about at the end is, a lot of people may benefit from extra support right now therapy is not just for people in crisis or just for people who are having trouble coping. It's also a space just to get some support for what you're going through and process the experience that you had. Getting COVID and feeling threatened in that way is a trauma. And sometimes we need to process that and have a safe place to learn how to get past that, how to ventilate how we're feeling, and then how to cope with it when it's coming up for us. So that leads exactly to what I was about to say, which is focusing on we can control, which is how we can take care of ourselves, the way we respond to our emotions and our difficulties when we're having them, our self-care, the way we connect with others, our habits and our routines, and efforts also to make time for pleasure and to have fun, even if right now that looks really different. So these are some of the other ways that you can maybe try to take care of yourself when you notice that you're feeling really angry and that's really impacting you. I'm going to bring up a slide for this one. This is something that I think is really useful, which is checking in with yourself daily. If it's not something that you think you'll do daily, maybe just on days you're feeling angry or overwhelmed, but I think it's useful to do every day. So I'm going to share that. Okay. How am I feeling today? Am I getting enough sleep? Am I feeling overwhelmed? What can I do today to address how I'm feeling, and what do I need? I don't think any of us really do this for ourselves on a regular basis. Maybe we do it for other people. Maybe you wake up and you walk out of your room and whoever else lives in your home, you ask them how they're doing and how their night's sleep was and how they're feeling today. We usually don't do this enough for ourselves. So this daily check-in is really useful, because if you're noticing you're having this emotional reaction, you're feeling really angry, what can you do for yourself to take care of yourself that day? Maybe you need to implement some more self-care strategies on a day where you're feeling emotional or overwhelmed. And being aware of that is really important. So what are some techniques for self-care? Physical activity. So of course, always check with your doctor about any limitations or restrictions that you have, but the quantity is really not as important as the consistency. It is proven in the literature and so many research studies that some physical activity and exercise really improves mood, can decrease depression, can help with energy, improves sleep, reduces anxiety, and just makes us feel better. You have that release of endorphins, it just feels good. So while we probably have to be much more creative right now with getting activity, especially during the winter, not just the pandemic, but now it's so cold out, who wants to go outside every day? We have to get creative with how to get some physical activity. So some ideas, as silly as this may sound, I've actually done this myself on a freezing day. Go for a walk around your apartment. It's not the most stimulating, exciting thing to do, but after I've sat in the chair all day and I know that I'm feeling a little anxiety or a little frustrated, I know I need to move my body. It was a freezing day outside. I literally walked laps around my apartment while making a phone call, just to get a little of that out of my body and get a little physical activity. Going for a walk outside on days that are less cold is really, really helpful. There's a lot of YouTube videos or virtual platforms for workouts you can do for yoga or stretching. And another strategy I think is really useful and creative right now is making a date with someone, a friend or family member, to do a workout with them virtually. Then you have a plan to do it. It's sort of a social thing and you're committing to it and a little more accountable for it. The way maybe you used to go to the gym or go to rehab, outpatient rehab, or go to a workout class or go for a walk with someone, having that commitment and that accountability is really, really useful. Eating well, which I know there was a presentation last week about nutrition and having a well-balanced diet, but that can impact your mental health as well. And I think right now, a lot of us are home all the time. Our eating habits may be different. And a lot of times we turn to comfort foods when we're feeling anxious or down. So just being aware of those things. Of course, it's okay to treat yourself sometimes, but really having a well-balanced diet can really impact your making plans. I think this is a huge one for right now, especially, again, always with mood and depression, but especially right now in the pandemic. Having some structure and some routine and some schedule, when most of us don't right now the way we used to, is really, really important. We need things to look forward to. We have to have some structure and some sense of routine, even if it's scheduling certain meals you're going to make for the week, or making a plan for a phone call, or going to sleep and getting up at the same time. We need some semblance of normalcy and balance and routine. And that can really impact your mood too, if every day is just feeling really monotonous and the same. Connecting with people, which I know a lot of us don't feel like doing all the time, but it's really, really important for mental health. Maybe that's once a week you reach out to someone you haven't talked to in a while, or someone consistently you like talking to that you have a certain day and time that you're reaching out to them. That's connecting with them and having a plan and some structure. Socializing is really important. And while it doesn't look the same right now, of course, we still need to make that effort, because even if you don't feel like having that Zoom that once a week, you're probably going to enjoy it when you're doing it and feel better after. Getting enough sleep is really important for your mental health, both for anxiety and for mood. If you don't get enough sleep, you're going to feel like you have less reserve to cope in general with every stress that you're having. Meditation or mindfulness, as I mentioned, I'm going to give some resources at the end if you're interested in learning more about that. There are a lot of great apps out there, a lot of free things that you can try to do some guided imagery or some guided progressive muscle relaxation, or some of the techniques that I showed you before. Limiting consumption of news and social media. I think this is a really important one with how stressful the world is right now. Of course, a lot of us really want to be well informed and maybe watching the news every single day, or being up on Twitter or whatever it is that you get your news from every hour is really important to you. It really can be too much and cause so much anxiety and so much feeling of frustration and sadness, because we don't have control over it. And I'm not saying don't be aware of that, but you need to be aware of how much you're consuming, because there is such a thing as information overload, and it really can impact your mental health and your mood. Journaling. Yeah.
So Rachel, I got a question that came in,
Mhm.
and this is in regards to what you just mentioned for social media and having the information at our hands, and anyone now can post things. But I have a friend on social media that claims to be a mental health expert. Are there any credentials for mental health experts, or how do I know who to trust nowadays?
Hmm. That's a very good question. There are a lot of Instagram and Facebook accounts with mental health tips. So I think in general, people are trying to be supportive or sharing quotes or resources or coping skills they've used or learned from others that have worked for them, and they want to share that with others. And I think if it's something that resonates with you or you want to try, that's great. I think that word expert is the one that you need to be aware of when it's something more than that, more than a app to try or a coping skill or a way to think about something. When you're thinking of an expert, you want to think about someone who has an advanced degree in mental health and the proper training to guide you with what you're struggling with. So there are several degrees that you can get to be quote unquote an expert in mental health. I would say the main ones are a licensed mental health counselor, a licensed master clinical social worker, a psychiatrist, psychologist, marriage and family therapy counselor, or an APRN with a psychiatric specialty. Those are the ones that come to mind first. So I think that expert word can throw you off a little. And if it's anything really where you're trying to seek treatment or want to know if what you're going through feels normal for you or if you do need help. But otherwise, I think a lot of these social media accounts are well-meaning, where they're sharing quotes or websites they liked or guided meditations or wherever it may be. And I don't think that necessarily needs to come from an expert to be useful.
Great.
So it is a lot out there. So that's a really good question to ask. Journaling. A lot of people may scoff at this, and journaling is not just for writing about the things that you went through that were hard or the times that you're having that are challenging. Journaling can be a useful tool when you use it also in times where you're feeling okay or you've coped with something stressful, to write down how you dealt with that and then use that as a resource when you're having a hard time again. A lot of us, when we're feeling stressed or down or anxious, don't feel like we can access some of our coping skills or some of this critical way of thinking sometimes. And having a journal where you've documented also the times that you have dealt with stressful things or gotten through it or how you did that can be really, really useful to use as a resource when you feel like it's a little more challenging intrinsically to support yourself in that moment. Volunteering has been studied and shown to really help with mood. It can be really therapeutic to help other people. And even if you really don't feel like it, those of you who have participated in something like this, it really brings you out of yourself in a way where you're not concentrating on what's hard for your own mental health. And it's just so therapeutic to help other people and participate in that way. And it's also connecting with others. Practicing gratitude. And if, I want to leave time for questions, but I can teach a technique if there aren't more questions about one simple technique to use gratitude. When I say practicing gratitude, what it is trying to be more aware and pay more attention and appreciate small things in your day that normally go unnoticed. So even if that's sitting down at dinner and talking about 3 things you were thankful for that day, or this simple technique I can tell you where you're just trying to notice things that you learned or something you accomplished or something that gave you delight. If you're doing that on a consistent basis during the day, you're going to pay attention to those things. So you have things to say for that gratitude exercise. And it's going to try to rewire your brain a little bit to focus more on the positives. Again, the opposite of that negative noticing. What are the small things in the day that felt good that I can appreciate? Maybe I went outside and the sun felt really good on the inch of my skin that wasn't under my hat and my mask, or I got a text from somebody that made me feel really good, or I had a really good meal, or I wore a really comfortable pair of sweatpants today that I wouldn't have been able to wear to work normally if I had to go in. Little things like that. You want to sort of rewire your brain to focus on the positives and the things you're grateful for. And then finally, as I mentioned, therapy if you feel like you're needing help. And that doesn't mean you need to only go when you're really struggling or really feel like you can't cope on your own, or some mental health issue you're having is really impacting your functioning. Therapy is not just for crisis. It is for getting support, learning coping skills more in depth, some of these, processing what you've gone through, gaining more insight into the way that you think and feel and how to respond to yourself and how to cope with that. And also have a safe, non-judgmental space to just talk about whatever's going on for you that's just for you. And so I'll have some resources now I'll bring up if that is something that you're interested in. But I would say with any of these self-care techniques or any of the techniques I told you at all, you may walk out of here feeling excited about them or have the slides and say, I'm going to try all of these. You want to make really small goals that are attainable that you can sustain. That's the only way you're going to commit to it. So maybe it's just you're going to try the breathing and see if that's something that helps you this week, or you're just going to practice gratitude, or you're just going to call someone this week to see how it feels to socially connect. You don't want to take on too much because you're not going to be able to sustain those changes. And I think that's really important. So I'll bring up the resources now. Here we go. So if you are looking for a referral for therapy, your primary care physician is usually the best person to go to first. Someone who knows you well, may have referrals of people that they're familiar with or familiar with you and your issues that you're having. But these two websites are also really great, heightsite.org and psychologytoday.com. And you can actually filter by your insurance coverage and your zip code. Zip code, I know right now doesn't matter as much because most therapy, if not all, is all being done virtually right now. But you can look through and filter by specialty or issues that you're having, like chronic illness or anxiety or depression or insomnia. So it's really, these are both really great websites for that. NYC Well is a very, very important resource. So you can actually text this number or call, and they'll give you resources or connect you with mental health specialists. And they have this really great COVID-19 digital resources page. They have all these mindfulness apps that you can try, suggestions for exercises to do, a lot of support groups. They just have a ton of resources now. Again, they're aware of how challenging this time is, how many people are feeling anxious and down, and what a tough time everyone's having coping. And they have a lot of resources specifically for this period. And then if you ever have a time where you're having, thoughts of hurting yourself, of course, call 911 first, but there's also the National Suicide Prevention Hotline. You can call if you're just really feeling overwhelmed, let's say in the middle of the night, and you need to talk to somebody. This is a number that you can call. So the other thing I'll mention, I didn't bring up all the slides tonight with some of the things I talked about, but when I send them out, there are a couple of slides just further outlining this gratitude technique, if anyone wants to reference this, which is something you're grateful for, something you learned, something you accomplished, and something you took delight in. I listed out some of the self-care strategies, so that's there for you guys if you need it. And the unhelpful thinking patterns, I think I also didn't share, but I had gone over. So those are also in the slides for you. And that's all I got.
Rachel, thank you so much. This has been probably one of the most engaging and thought-provoking webinar sessions we've had thus far. And I think I can speak for everyone when I say that it's been a great presentation, a lot of useful information, and helpful tips for all of us during this very troubling time. I want to remind everybody that we have these webinar sessions occurring at least twice a month. We try and schedule them in the evening so that we can have a larger attendance. Next month is American Heart Month. We will have our very own Dr. Marianne McLaughlin do a presentation discussing heart health and have a component of women's heart health incorporated into that. If you are receiving our newsletters, stay tuned to receive our February newsletter. When it comes out, we will have the calendar schedule. If there are any other questions that you did not get to ask in the survey, you can go ahead and put your question in there and we'll try and get back to you as soon as possible. The slides will be available. This recording will be available, and we'll have it for anybody who wishes to see this at a different time or share it with somebody else. So with that, I'd like to thank everybody for joining in tonight. Rachel, again, thank you so much for such an intriguing topic and awesome discussion. We'd like to have you again sometime in the future for more discussions like this. And I want to just say thank you, everyone, and good night. And until next time.
All right. Thanks so much.